graduates in pathology.
Cystically dilated spaces.
Both of them have got cystically dilated spaces. Very
Yes, ma'am.
good. Now, Ria, you mentioned something about congestion of vessels, and here you talked about hemorrhage, right?
Yes, ma'am.
When you're making a description, what is the purpose of a description, Ria? Can you tell me the purpose of a description? What are we doing when we are making a description?
Ma'am, we are trying to reach out to a diagnosis.
We're trying to reach a diagnosis. Okay, anybody else has got any other views on this? Yeah, Vimi, why do we make a description?
Ma'am, it is to have a good observation about the tissue, what we are seeing, and to know the normal and what is the pathology, and give a good description about.
Very good, excellent. All right, anybody else has got any other thoughts? Yeah, Limpy, do you agree with what has been said before, or do you want to add or anything to this question? Why do we need a description?
For good observation and for making the good diagnosis, ma'am.
I can't hear you, Limpy. I don't know if everybody else can. Yes? Can everybody else hear Limpy?
I cannot see, ma'am.
Sorry? You can't see what?
Limpy.
Yes, ma'am.
Yes, Limpy? You
Yes,
can't
ma'am.
see the
For the
screen?
good observation. Yes, yes, ma'am. It's visible, ma'am. Screen
Okay,
is
very
visible.
good. Okay. So,
Ma'am, for the good diagnosis and for
so we make a description because we want to reach a good diagnosis. All right. Suveta?
pathology.
Yes, ma'am. To get an approach to the diagnosis that we can differentiate the lesions.
Very good. So now I asked Dia, you see, she said something about congested blood vessels, and I guess Dia, you were talking about some little congestion over here. See, I marked it. Yes, and you talked about hemorrhage over here, right?
Yes, ma'am.
Very good. Now I want to ask you, do you think that you are noticing that there is a spot of hemorrhage on the right side and that there is a small congested group of blood vessels on the left side? Is that going to help you to make a diagnosis?
No, ma'am.
No, ma'am. So, do you think then that it was worthy of a description?
No, ma'am. It might not have been included in the, means it was not essential to include it in the description.
In the description. So, really, what should the description include?
Ma'am, certain things and description should include those things which are helpful for reaching to a diagnosis and also excluding the differential diagnosis.
So, in other words, we should try to make a description, or we have to assess again. All right. We don't know what ultimately is going to help us or hinder us in making a diagnosis, but we have to make an assessment as to what are the relevant, and this is the operative word, relevant positive and relevant negative findings. Okay, so number one, a description is not about only what you see, and there are many irrelevant things that one sees. Okay, there may be spots on the slide, and there may be dust and God knows what that has been included, but surely we don't want to describe that, isn't that right?
Yes, ma'am.
Yes. So we want to try and assess what observations are going to be relevant to our diagnosis. And we have to look at not only what we see, but we also have to make an assessment of what we don't see and what we are expecting or we should be seeing, but it is not there. Agreed? So it's
Yeah.
relevant, positive, and relevant, negative findings. All right, good. So far your description has been good. All right. Now, can I ask you about case this on 1A? You said
Yes, ma'am.
something about these being papillary processes. Isn't that right?
Yes, ma'am.
All right. So now, would you like to tell me why you think that these are papillary?
I told that these are
Then please, yes, I know that, but you please ask to annotate, and then please use your annotation pen to tell me why these are papillary, because you use that term.
Yeah, okay, okay. Ma'am. Yes, ma'am. I sent you a request.
Right. Okay. Now come on.
Yes, ma'am. I think that if I draw a line from here, if I think
You draw a
that,
line from there. Okay.
and if I then I see that these projections are above this basement membrane.
They are above the surface. You don't mean basement membrane. You mean
Yes,
the
ma'am.
surface, right? Yes, you mean the surface, right?
Yes, ma'am.
Yes, okay, very good. So they are above. So everything that you see in pathology that is above the surface is a papilla. Is that what you're saying, Dia? Yes?
No, ma'am. Not always.
Not always. All right. But this, according to you, is a papilla. Why? Why? So you called it a papilla. So I'm just wanting to ask why.
Ma'am, there are finger-like projections.
Finger-like projections. Okay. You want to draw the finger-like projections, please?
Yes, ma'am.
Can you outline them?
Yes, ma'am.
Do you think that those are finger-like projections that reach the, the surface? Are they only finger-like projections, or there are some other projections that are not finger-like? Everything is finger-like?
Not, ma'am. Not everything, but
This thing is finger-like?
no, ma'am. Not this
That
one.
is not. So now, what kind of papilla are you going to call that? What sort of papilla are you going to call it? Anybody else? Come on now, one by one. That was Dia. So, Limpy, do you think Dia is right when she called this a papilla? You just have to answer yes or no. Yeah, Limpy, are you there? If you don't answer immediately, I don't know whether you are there or you're not there. I don't know if she's there or
Hello,
not.
ma'am.
Suveta?
Hello, ma'am.
No,
Yes,
ma'am.
Suveta.
Papilla should have a fibrovascular core in the center.
All right, so a papilla should have a fibrovascular core in the center,
Yes.
right? Very good.
It can be called a pseudo papilla, ma'am, because true papilla will be having a fibrovascular core.
All right. Okay, very good. What about you, Vimi?
This is not true papillae, not seeing any fibrovascular core. It's just dilated epithelium, like a
Who is talking in the background, please? Is that Limpy? Limpy, is there somebody else in the room with you?
I've muted her, ma'am.
All right. Okay. Okay, yes. Well, I think that there is some doubt about whether there are papillae in this thing at all. Okay, what is it actually that is happening over here? You know, when you say that something is papillary, you are making some kind of inference, that is an interpretation, and what you mean is that whatever is growing above the surface, like you said, number one is epithelial, and number two, it is that epithelium which is the true lesion in that particular, that is actually forming the papilla, like a papillary carcinoma, okay, or a papillary cystadenoma, or a papillary a papilloma of the skin, okay, or the epidermis, or anything. What does it mean? That proliferation that is growing exophytically, or for that matter, endophytically, into a space or into its stroma, actually is of epithelial origin. Okay. Now you look very carefully over here. Do you think that this lesion that is exophytic, and it definitely is exophytic? Do you agree, Dia, that this
Yes,
is
ma'am.
exophytic?
Yes, ma'am.
Very good. So, is exophytic is not the result of the epithelium, which in this case is squamous epithelium of the tongue. Isn't that right?
Yes, ma'am.
Right. Do you think this lesion is the result of the proliferation of the squamous epithelium? Do you think so? If you think so, then you are right to call this a papilla. If you don't think so, then you are not right to call this a papilla. So do you get why or when we should limit the word papilla to? It means that there is a proliferation of an epithelium into above the surface, into a lumen, or whatever way you want to describe it, but that it drags along with it, yes, its fibrovascular core. So it is essentially a proliferation of that epithelium, and there is no other pathology that is associated with it.
Yes,
Okay,
ma'am.
now tell me, Dia, how certain are you that this is a papilla?
No, ma'am. Now I would tell that this is not a
So how would you
papillomatosis.
describe this? It is?
Ma'am, now I would tell that it is an exophytic growth having a stratified squamous lining, and there are some cystically dilated spaces in the subepithelial region.
Yes. So, and it's not just some cystically dilated spaces. There are numerous cystically dilated spaces, some of them filling the entire stromal content of that exophytic squamous lesion. Isn't that so?
Yes, ma'am.
Yes. So this is not a true papilla, because if you make the mistake of just calling it a papillary lesion, you may come to the wrong conclusion. And that was the reason I asked, why do we need to make a description? A description is nothing but composed of two different things. Number one, observations, and number two, interpretations of those observations. So it is observation plus interpretation. So it's not just an observation, but when we make an observation, and here we have this epithelium, which is squamous epithelium, in growing in an exophytic way, yeah, and there are
Yes,
two
ma'am.
cystically dilated spaces that are filling that stroma, and you put
Yes.
two and two together, and your interpretation is that this is not a papilla. Do you get me, Dia? Does
Yes,
it make
ma'am.
sense to all four of you?
Yes, ma'am.
Yeah, has Limpy arrived, or is she disappeared
Yes, ma'am.
again? Limpy,
Yes,
are you
ma'am.
there?
Yes, ma'am.
Yes.
Yes, ma'am.
Okay. So I hope you've understood what it is that we are talking about. All right, come on. Dia, is there anything now that you want to say about this? This is at higher power.
Yes, ma'am. In the upper topmost picture of 1A, we can again see those many cystically dilated spaces having some secretions within them. And in the lower picture, I can see that these are irregular cystically dilated spaces in the stroma, and it is associated with marked mononuclear cell inflammatory infiltrate in the stroma. And
All right.
in the
Before we
right,
go to 1B, can I ask all the other three, do you agree with what Dia said? Or is there something that you would like to either disagree or add? You can start with Vimi.
Ma'am, subepithelium is showing some pale eosinophilic material with inflammatory cells more towards the subepithelium, towards the epithelium.
So I just wanted to ask, you have more or less said what she said. Did you disagree with anything that Dia said?
No,
Or
ma'am.
you agreed with everything that Dia said? Because you're just repeating otherwise.
Yes, ma'am. Nothing.
Dia, you know what you said? Can I repeat what you said? You said that there were cystically dilated spaces that contained some pale secretions, right?
yes, ma'am.
And that there was a mononuclear infiltrate
Inflammatory.
that was seen. Yeah.
Yes, ma'am.
Now let me ask Vimi, you agreed, right?
Yes, ma'am.
Okay. What about you, Limpy? You agree? Limpy, you have to answer quickly. Do you agree? Limpy is not there. So, Sumita,
Yes, ma'am. I can see the inflammatory infiltrates, ma'am, but not sure if they are mononuclear in this field
all right.
at this.
So that's the only thing you disagree. Now I want to ask the three of you, well, Limpy is not there, but those who are here, including Dia,
Yes, ma'am.
do you agree with Dia's use of the word secretion? I said exactly what Dia said. So now, Vimi, you agree with the word secretion?
Not the secretion, ma'am. Actually, it's a pale eosinophilic material that is being filled in the area.
Dia, do you want to change that word secretion?
Yes, ma'am. Yes, ma'am. I was
Why?
wrong. Now I am getting it, because secretions I would have used only if there was any lining to it. Means if there was any cuboidal or some columnar lining, then only some space would have secretions.
I see. Okay, Suveta, now you've heard both Vimi as well as Dia.
Yes, ma'am.
Very good. So now do you agree with both of them or you disagree with either of them or what?
I don't think it is a secretion, ma'am. It is just a
You think
eosinophilic
it's a
material.
secretion.
No,
Okay.
ma'am, it's a
Very
eosinophilic
good.
material.
So now let us come to a discussion of what is a secretion. So I don't know about whether Limpy is there or not, but let me start with Dia. What is a secretion?
Ma'am, secretion is a content inside a space which is released by the cells lining it.
Right? So you tell me what are these spaces that release these things? What are these cells that release secretions?
Ma'am,
Can you tell
ma'am,
me?
yes, ma'am. Ma'am, any case, I can give example or I have to
You
stick
tell
this to
me.
this
Tell
one.
me. Yes, you can do it by example. Tell me.
Okay. Ma'am, suppose in intestine we have goblet cells, so it will be secreting mucus. So that's what call a secretion.
That is what is called a secretion. Okay. Vimi?
Ma'am,
Yes, Vimi, tell me. What is
secretion is what
secretion?
we one cell is secreting, but it's not should be included in a histopathology description, I think, ma'am.
Secretions are not to be included in a histopathology description, Vimi.
We will be seeing it a pale eosinophilic or a basophilic material. We can't
Oh my
say
goodness, I see. So if I see, in the thyroid follicles, I see this thick, viscous thing, I cannot call it a secretion. Or if I see it, if I see the, um, in the glands of the skin, for instance, okay, or anywhere, I can't call those things secretions. Why
And
not?
while describing, is that
Sumita,
secretion is
what
the
is a
purely
secretion?
It is a proteinaceous substance which is produced by the glands, which are lined by.
Produced by glands. Ah, okay. So they have to be produced by glands. And yet, Sweta, you call this a secretion? You said that. You agreed that this was a secretion on the left-hand side.
No, ma'am.
So I think that by now we should realize that secretions are produced. Yeah, they are extracellular material, yes, that is produced by an epithelial cell, right? Yes or no?
Yes, ma'am.
Yes.
Yes, that is what a secretion is. Now, if it is not epithelial, I think it would be hard to call it a secretion. And if we do call something a secretion, then what do we say? And it is not epithelial. Yeah, we call those things matrices, no? So if a mesenchymal cell produces what we would otherwise have called a secretion, yeah, there is collagen, there is osteoid, there is myxoid, there are lots of things that are produced by mesenchymal cells and are extravasated. Yes, that means they are extracellular. Now that becomes a matrix. When it is an epithelial cell, it's not a matrix, is it?
No, ma'am. It's a secretion.
It's a secretion. So now have we come to the conclusion that we use the word secretion? Of course, we often use secretion in a very colloquial kind of manner. But if we want to be specific about it, it means that it is an extracellular product, is it not? Of
Yes,
the
ma'am.
epithelial cell.
Yes, ma'am.
That is what is a secretion. So now is everybody agreed that this on the left-hand side is not a secretion, or is it a secretion? Start from you, Diya. Is it a
Yes, ma'am. It is.
secretion?
No, ma'am. It is not a secretion.
It's
Then.
not a secretion. Vimi,
not a secretion.
not a secretion. Suveta,
No, ma'am. It's not a secretion.
it is not a secretion. Limpy, Ram, is Limpy there or is she disappeared?
She's left the meeting, ma'am. She's having connectivity issues.
All right, she's left it. Perhaps she's got internet connection. So we are certain that this is not a secretion. All right, and we'll come to why you think it is not a secretion a little later. Now, come on, Diya, what's on the right?
Yes, ma'am. In case 1B, we can see again those cystically dilated spaces which are having a back-to-back arrangement, and they contain some eosinophilic kind of material inside inside them, and surrounding them are this fibrous tissue uh, all throughout the section.
Fibrous tissue all throughout the section. What do you mean by surrounding this is fibrous tissue?
Ma'am, these are divided into cystic spaces by the fibrous septa going through in between them.
Right? So there are fibrous septa in between these cystic spaces, right? So surrounded by fibrous tissue doesn't mean anything much. All right.
Yes, ma'am.
All right. So now let's go to the next. Now tell me what you can see at this part.
Ma'am, in case 1A, I can see only, apart from the previous description, I can only see those mononuclear inflammatory cell infiltrate in the stroma. And in the lower picture, again, it's the same picture which was depicted previously. This one is a cystically dilated space which is having an irregular outline, and it is associated with chronic mononuclear inflammatory cell infiltrate in the stroma.
All right.
And
Whenever you see a cellular, whenever you see a space, what are the
yes,
things that we need to describe about that space?
ma'am, first of all, whether it is lined by anything, whether there is any cell lining,
All
and
right.
the contents of the cyst.
Uh-huh. So,
And ma'am,
have you told me anything about the lining?
ma'am, lining, I'm not sure in this picture. That will be more evident in the higher magnification picture.
So that the lining is what?
Mm,
What is the lining?
ma'am, in this case 1A, ma'am,
Yes, in 1A. What is the lining?
ma'am, it is having a discontinuous lining by the ma'am, it is having a discontinuous lining by the endothelial cells.
Discontinuous lining by endothelial cells.
Yes, ma'am.
Really think that that endothelial cells are discontinuous? Cannot be, no? All right. And what on in case 1B?
Ma'am, in case 1B, I can see this infoldings inside this cystically dilated spaces, and these infoldings are lined by cells, which are,
Infoldings of what?
ma'am, ma'am, infoldings of the lining epithelium,
Okay. All right.
and these are lined by cells which are low cuboidal in nature.
Right. So what do you think this is? Do you think that this is epithelium? It is an endothelium, or what is it?
Ma'am, I think in case 1B, it is epithelium,
It is
epithelial
epithelium.
lining.
Everybody
Yes, ma'am.
agrees? All three of you, the rest of you agree?
Yes,
Jimmy,
ma'am.
Yes, ma'am.
you do. Okay, Suveta,
1A also, I think it is an epithelial lining, ma'am.
1A also you thought was an epithelial lining.
Yes, ma'am.
Suveta, if you thought that 1A was an epithelial lining, then why did you say that that was not a secretion? You agreed it was not a secretion. If you have an epithelial lining and you have something inside of it which is pale or moderately pink, why did you say it was not a secretion then? There's something contradictory about it, right?
Yes, ma'am.
Yeah. Now you can see the thing at higher power.
Yes, ma'am.
So now,
Ma'am.
Sumita, you want to make some observations in 1A.
Yes, ma'am. It is lined by flattened epithelium, ma'am, and I think it is a secretion, ma'am.
You still think that that is flattened epithelium? Yes.
Yes, ma'am.
All right. Very good. And what do you think, Suveta, about 1B? That's also epithelium.
Yes, ma'am. Flattened to low cuboidal epithelium.
Epithelium. All right. So, according to Suveta, both 1A and 1B have got flattened epithelium. What does Vimi think?
Ma'am, the case 1 is having flat endothelial lining, not the
Okay.
epithelium. And the case 1B is having that low cuboidal epithelial lining.
Epithelium. So there are two of you, and that is that Limpy? Because I can hear some hello in the background. Is that you, Limpy?
No, ma'am, Limpy is not there.
Oh, Limpy is not there. Okay. So we have a difference of opinion over here. Let's see if, yeah. So, and Sumeta,
Yes, ma'am.
they think that this is, this epithelium, what you think is an epithelium in 1A is
Yes, ma'am.
actually an endothelium. Will you explain to them why they are wrong? There is no discrepancy about 1B. Now,
Yes, ma'am.
Sumeta, will you explain to them why they are wrong?
Thought it was a continuous lining, and the cells have the nucleus appears flattened, and
Yes. Yes. So you said two things. You said the nucleus appears flattened, and you said that it is a continuous lining. So
Yes,
what
ma'am.
does that make it an epithelium? These two features that you saw, they
Yes,
are going to ask you, and I'm asking on their behalf, why do those two features make it an epithelium?
I'm not sure, ma'am.
You're not sure, but you said it was an epithelium. Despite the fact that they said it was an endothelium, you persisted in calling it an epithelium. So now tell me, you must have some very deep-seated reason, right, for wanting to call it. In the meantime, Bonita, is anybody in the chat box, please ask them to answer, or I'm asking them and they can answer. What do
Yes,
they
ma'am.
think that case 1A the cysts are lined by? Epithelium or endothelium?
Somebody said it's lymphatic spaces. Oh,
Somebody said it is lymphatic spaces, but that doesn't say, I assume that they think it is endothelium because it is lymphatic spaces, unless they think that lymphatic spaces are lined by something else. Yeah, any other answers in the chat box?
not yet, ma'am.
Not yet. Okay. So now, yes, come on. We have to get to the bottom of this, Suveta.
Yes, ma'am.
So tell me, you said something very interesting. And that was also something that Dia said, that this is a discontinuous lining. And you said that you found it continuous and therefore it is an epithelium. Dia said it was discontinuous and that's why she thought it was an endothelium. Am I right, Dia? That's what you said, right?
Yes, ma'am. But I was telling that it is a lymphatic endothelium, not a vascular space endothelium.
So what does it matter whether it's lymphatic or vascular space? What's the difference? It's an endothelium, right?
Yes, ma'am.
So you thought there is some story you have heard that a lymphatic endothelium is discontinuous? Where did you read that? An endothelium is an endothelium, whether why should it be discontinuous? You mean that lymph keeps on leaking out of its endothelium? So that
No,
we
ma'am.
are all over the place, we are full of lymph. Huh?
No, ma'am.
No, madam. Okay. But I think that there is some prevailing view because it was reflected in two things. One that you said and one that Suweta said. And what did Suweta say? That it is continuous and it is flattened, which suggests, Suweta, that if something is continuous, it must be an epithelium. Is that what you believed, Suweta?
No, ma'am. Epithelium can also be discontinuous.
Oh, an epithelium can also be discontinuous. Acha. Now that is interesting to me. Which epithelium is discontinuous, Suweta?
When there is ulceration.
Or if there's ulceration. But do you think that this is ulcerated epithelium or something?
No, ma'am. No,
Lining
ma'am.
those cysts?
No, ma'am.
So there is some confusion going on, okay? When we see dilated spaces, which are essentially sitting in a stroma. Do you realize that, Suveta, that these dilated spaces are sitting in a stroma, right?
Yes, ma'am.
They are flattened and they contain some pale material that is inside these spaces. We have very little doubt that it's unlikely that these are going to be epithelial spaces. All right. So now, for the sake of the audience and for the sake of you, when we look at something at low power, we ask these 5 questions. Do you know that we ask these 5 questions? I don't know if you ask these 5 questions, but I do to myself. So it makes my description easier. And I think, Dia, you can answer these questions. And these are the 5 questions I ask myself always at low power. And the first one is there any normal tissue or structure present? Is there anything normal or
Yes, ma'am.
what is that?
Ma'am, the stratified squamous epithelium.
Very good. Is there any abnormality seen?
Yes, ma'am.
Very good. What is the relationship of the normal to the abnormal?
Ma'am, some of these cystic spaces are lying intraepidermally.
Some of the cystic spaces? Only some or all?
Ma'am, some are lying intraepidermally and many of them are lying in the stroma, that is in the subepithelium.
Some of them are lying intraepidermally. You can actually see them in the epidermis. Can you point out one over here that is lying in the epidermis?
Yes,
In
ma'am.
the epidermis. Yeah, okay. Yeah, tell me. Where?
Ma'am, this one.
That is in the epidermis? You think so? What's surrounding it? Let me ask Vimi. Do you agree with that what she has drawn is in the epidermis?
Ma'am, it's in the subepithelium only, I think.
So why is it looking like this, as if it is bloated?
Um,
Ma'am, maybe it is pushing from the epithelial region towards the epidermis. That's why.
Yes, because this is something that has been cut tangentially, right? So it looks like it is surrounded on all sides by epidermis, but actually it is not because it has been cut tangentially. And you can
Yes.
get a structure that looks as if it is surrounded on all sides, but it is actually subepidermal. Okay, I just want
Yes.
you to look at so many of these things. If you cut them tangentially over here, what will it look like? And you think that they're intraepidermal? Yeah, I'm cutting this thing tangentially like this. What will it show? Dia?
Yes, ma'am. It will look like as if it was in the epidermis,
So
but
now,
actually it was in the
it is
subepithelium.
not, right? So it's
Yes,
not
ma'am.
some, it is all. So what is
All.
the relationship of the normal to the abnormal?
What is it?
What? The
Ma'am,
abnormality is present in the subepithelial tissue, right? It is in the stroma. So is there
yes,
a
ma'am.
pattern to this abnormality? What is the pattern? You've described it. So this is just a way of putting it all together. So what is the pattern?
Ma'am, back-to-back arrangement,
It
ma'am.
is dilated cystic spaces, okay? Now,
Okay, ma'am.
the fifth question always is, where should I direct my high power examination? So where would you direct it?
Ma'am, to the cystically dilated
The
spaces.
lining of the cysts, right?
Yes, ma'am.
That's what you would do. Very
Yes.
good. All right. Now come to case 1B. Is there any normal tissue structure present?
Yes, ma'am. Normal tissue is present.
What is that?
Ma'am, the normal pancreatic acinar cells.
Acinar cells. It's the pancreas, okay?
Yes, ma'am.
Yeah. Is there an abnormality that is present?
Yes, ma'am.
Very good. What is the relationship of the normal to the abnormal?
Ma'am, it is present as cystically dilated spaces.
Okay.
Uh,
It's not just that is the pattern. What is the relationship of the normal to the abnormal? It is well demarcated from the pancreas. Yes or no?
yes, ma'am.
Yes,
Yes,
very good. Is there a pattern to the abnormality?
ma'am. Yes, ma'am.
Yes.
Cystically dilated spaces.
Excellent. And where should you direct your high power? To the lining.
The lining of the cyst.
Okay. So now tell me, what is the lining of the cystic spaces? We have already discussed this. What is the lining of the cystic spaces in 1A? Come on,
Ma'am,
Monica, what is it?
Endothelium.
It is endothelium. So is it flattened epithelium, endothelium, or stroma? And the answer is
endothelium.
endothelium. Okay, that is extremely important. Now, what is this lesion, and how do we come to? How do we usually, or I do it all the time in my head? Okay, how do I have a schema or some algorithm to make diagnoses? Okay, so we start with, is it congenital or is it acquired? Come on, Sweta, is it congenital or acquired?
Acquired, ma'am.
Acquired. Very good. Is it physiological or pathological?
Pathological.
Pathological. Is it likely to be physiological? Huh? Answer. What is the answer?
I think it is
It
pathological,
is
ma'am.
pathological. Very good. Is it neoplastic or non-neoplastic? What?
Plastic, non-neoplastic.
Non-neoplastic. All right. What about you, Vimi? Neoplastic or neoplastic?
Neoplastic.
You think it's neoplastic. What about you, Priya?
Ma'am, ma'am, I think it's neoplastic, ma'am.
You think it's neoplastic. So why was Sweta saying non-neoplastic just because she wants to be contrary? The question is, how do we know? Okay.
Yes, ma'am.
We now know that this is endothelium, and what kind of endothelium is it likely to be? It is not full of blood, is it? No. So this has got a serous secretion in it,
Yes.
serous material that is in it, and therefore it's very likely to be lymphatic. Now, can you get dilated lymphatics in anywhere in a space? Can you?
Yes.
You can.
Yes, ma'am.
As a result of a non-neoplastic condition?
Ma'am, if there is any abnormality in morphogenesis, if there is failed connection between the lymphatics and the venous system.
And so then it would have been congenital, right?
Yes, ma'am.
Right.
Then it is.
Acquired condition?
Ma'am, sorry, ma'am.
An acquired condition, Diya, can you get dilated lymphatic spaces?
When there
Ma'am,
is
in
any
lymphangioma.
Lymphangioma is a non-neoplastic condition.
if there is
Ma'am.
any obstruction, ma'am.
Obstruction, which can happen, right? Have you ever seen a person who has had extensive dissection of the lymphatics and then begins, or for that matter, has lymphatic obstruction by filariasis, etc.? Can you get dilated lymphatics?
Yes, ma'am.
Right. So this Suveta is right. She's very uncertain as to whether this is neoplastic or non-neoplastic. But whether neoplastic or non-neoplastic, is this malignant or is this benign?
It's benign.
It's benign, yes. It can be either benign or it could be the result of some kind of vascular disorder. And when I mean vascular, I don't mean blood vessels, I mean lymphatic vessels. It can be one or the other. But now we know something else. No? In the history, we know that this is a lesion on the
Tongue.
the tongue. Yes. And what else do we know about this? You saw this lesion. It has been removed. That it is just a localized lesion that is exophytic. So now,
Yes,
do you think that this is likely to be non-neoplastic? What is your answer, Diya? What's your diagnosis?
Ma'am, my diagnosis is lymphangioma, ma'am.
Lymphangioma. But there is a particular kind of lymphangioma that is seen above the surface and associated with squamous of epithelium as a rule. So what is that called?
Ma'am, lymphangioma circumscriptum.
There you are. So it is circumscribed. It is there is a dilated lymphatic spaces, and so this is lymphangioma circumscriptum. Very good. You all arrived at the diagnosis in good order. Okay. So,
Yes.
Sweta, you agreed that this is not an epithelium.
Yes, ma'am.
What was your diagnosis, Sweta?
I thought it was a mucocele, ma'am.
You thought it was a mucocele. All right. Now you know that it is not a mucocele.
Yes, ma'am. Yes, ma'am.
Why?
The lining space is endothelium. It is, and
So you thought it was like a ranula?
Yes, ma'am.
But a ranula never has these kind of dilated spaces that are completely, that each space is completely lined by a flattened epithelium. Did anybody else think it was a ranula? I hope not. Okay, this is not a ranula. Okay, now come on, Vimy. What is the lining of this space, of these spaces?
Ma'am, this is epithelial lining, low cuboidal.
All right. So if you have to flatten epithelium, endothelium, or stroma, what is it?
Flattened epithelium.
Excellent. So now answer the question is the answer all these questions. What will you choose? First line, congenital or acquired?
Acquired.
Acquired. You're sounding very uncertain. Are you sure?
Yes, ma'am, it's acquired.
All right. Next line.
Pathological.
Okay, you're asking two
Neoplastic.
questions. Neoplastic. Okay.
And it's appears benign.
Benign. So what's your diagnosis? What's your diagnosis? Vimy, you've got flattened epithelium. You're telling me that it is a benign cystic neoplasm because that's what you said. It is benign cystic neoplasm of the pancreas with flattened epithelium. Okay? Anything, Vimy, you want to say about its epithelium? It's cuboidal. That's what was said by Dia. Anything else about this epithelium? Is it just merely cuboidal or do you want to describe those cells?
Ma'am, it's cuboidal only, cuboidal cells.
All right. Anybody else? Sweta?
Yes, ma'am.
Eagle eye, can you see anything that you might want to describe those cells as? It's cuboidal, of course they are. But how do we describe an epithelial cell? Or any cell for that matter, Suveda, what are those things that we say about cells?
The shape, ma'am, it looks cuboidal with a basally located nucleus and moderate eosinophilic cytoplasm.
Suveda, you have a cuboidal cell. What do you mean by basally epithelium?
Sorry, ma'am, it's centrally located.
Yes. All right. Then?
And eosinophilic cytoplasm.
Eosinophilic cytoplasm. Okay. Are you looking carefully?
Ma'am.
Yes, and it is eosinophilic. You want to see these cells? What do they look like? It's all part of the same.
They have a clear cytoplasm.
Is that the only place that you can see the clear cytoplasm? Now look carefully.
Many cells, it is clear.
So there are clear cytoplasm. There are many cells that show clear cytoplasm. So Veda, can you see them?
Yes, ma'am.
Excellent. Dia, did you see them?
Yes, ma'am.
Okay. So what does clear cytoplasm mean, Sueta?
There is secretion in it, ma'am.
There is secretion inside them. What sort of secretion? Clearing means what? So what are the cells in the body that are clear? What do they contain?
Adipocytes, fat.
Adipocytes, so it may contain fat, yes. Then?
Glycogen.
Glycogen, very good. Or?
Mucin.
Mucin, which is very thin mucin. And therefore, it may get washed out and you can see a clear cytoplasm. Now take a guess, Suveta. What do you think this clearing actually is? So you have a cystic, benign
Can be due
neoplasm
to
in the pancreas
thin,
with clear cells lining the cysts. Yes, Suveta?
Can be due to the thin mucin, ma'am.
Due to thin mucin. Okay. Now let's ask Dia. What do you think?
Ma'am, the clearing of the cells is due to the presence of glycogen.
Glycogen. Okay. And what about you, Vimi? What do you think? One has said glycogen, the other is thin mucin. What else is left, Vimi?
Thin mucin.
Thin mucin. Okay. Well, let us find out. What is it? Sueta?
Yes. PAS without diastase that demonstrates glycogen.
PAS without diastase demonstrates glycogen. How?
Sorry, mucin, ma'am.
Mucin. Okay. And what have I done on the other side?
PAS with diastase.
And what has happened?
It hasn't taken up the stain.
So, what does that mean? Suveta, what does it mean? Suveta, have you
Mucin.
ever done a PAS with and without diastase?
Yes, ma'am.
You have. All right. So, this is the same tissue, right? This
Yes,
has been
ma'am.
done without diastase digestion on the left side. The other one was done, a PAS was done with diastase digestion. So what does it mean? There you see these two pictures.
Glycogen.
So
Glycogen, ma'am.
it means glycogen.
Glycogen, Miss.
Very good. So since you have seen this and now we know that it is glycogen, can you tell me what the diagnosis is? It's written over there.
Serous adenoma.
Of the pancreas. It is a typical case. If people had, and I think Dia did reach the right diagnosis. Did you think that that was the diagnosis, Dia?
Yes, ma'am.
Right. Did you do it on your own or you discussed it in your department? It doesn't
No, ma'am.
matter to me.
No,
Very
ma'am. I
good.
did it with my own.
Vimi, what diagnosis did you reach? Vimi? Vimi's gone. All right. Suveta, what diagnosis did you reach?
I thought the same, ma'am. Serous adenoma.
And still you thought there was thin mucin in it? Suveta? So how could there have been thin mucin in a serous cystadenoma of the pancreas? There is only one thing that is present in serous cystadenoma of the pancreas, and that is glycogen.
Glycogen.
Suveta. So it's not about matching pictures, Suveta.
Yes, ma'am.
It's about, yes. So you have to know everything about it. All right. Very good. Right, now let's come to the next one and we have to go quicker than that. Come on, Suveta, take this case.
Case number 2, 2A is for 46-year-old male, biopsy of a mass at the gastric fundus. The other side, it's a 66-year-old male with biopsy of a nodular gastric mucosa.
Very good. Come on.
In 2A, I could see a fragment of biopsy specimen taken from the gastric mucosa. The mucosa, it is showing a foveolar epithelial lining with the underlying glands. And on the right side, I can see the foveolar epithelial lining, which is focally ulcerated, and the underlying.
Totally ulcerated. Show me the ulceration. Ask for
ma'am.
annotation. Yes.
Yeah, ma'am, this area.
Where is the ulceration? Right. So you feel that there is some ulceration over there.
Yes,
It's
ma'am.
not just denuded like it is seen over here by the fact that it has been biopsied or some rough handling. Huh?
Yes, ma'am, it can be a denudation.
All right, good. But you never said to me
Ma'am.
whether you think that there is, what is this left side thing, from where is this gastric biopsy been taken?
It is taken from the antrum or the cardiac portion, ma'am.
This biopsy over here is taken.
This is taken from the fundus, ma'am.
Yeah, so what is the meaning of the fundus? What kind of mucosa is this? Fundus, what does the fundus have? Is it cardia type? Is it antral type? Is it body type? What is it?
Body type, ma'am.
So why did you say antral and So this is, how do you know it's body type mucosa?
Because
Yes,
the
Shweta, how do you know?
glands and the foveolar epithelium, the foveolae predominate the glands, ma'am.
The fovea are longer than the glands.
Yes, ma'am.
Is that what you're saying? Shweta, are you
ma'am.
hearing yourself speak?
Yes, ma'am.
You're calling this gastric body mucosa and you're telling me that the foveolae are long. Hmm? Yeah, Dia?
No, ma'am. In body type of mucosa, there will be mainly parietal type of cells and also chief cells.
Excuse me,
So,
ma'am, we are talking about the foveolar epithelium. Yes.
yes, ma'am.
What is the length of the foveolar epithelium as with respect to the glands in the body mucosa?
Ma'am, it will be shorter, not like the gland, not
Okay,
like the
shorter. How
foveola.
much shorter?
Yes, ma'am. 25 is to 75 ratio.
25
Yes,
is to 75 ratio. All right. Vimy? Vimy's also disappeared?
No, ma'am. No, ma'am.
You're there.
Yes, yes, ma'am.
Yes, okay. So now please tell me on the left-hand side, which part of the gastric mucosa is that?
This is fundic, ma'am.
Fundic means what? Fundic means what? Is it the same as body? Is it like the antrum? Is it like the cardia?
Um,
You don't know,
no, ma'am.
right? So Dia is right that this is gastric body mucosa. Suveta also said that, but Suveta didn't know why she was calling it gastric body mucosa. Okay, body and fundus, there's nothing to choose from. They look the same. Okay, so please, this is gastric body mucosa, which is what you also see in the fundus. You have very short foveoli and you have the length of the glands is very long. Okay, it can be, you said 25% to 75%, it could be 30, 60, 30, 70, it could be, but it is really short foveoli, yes, into which many openings of the glands are. There's more than one opening of the gland into each gastric pit.
fovea.
Oh yes. All right. Anything else you see over here, Suveta, on the left-hand side?
Yes, ma'am. The glands, ma'am.
Is there anything wrong with the gastric mucosa and the glands? Is
I
the
don't.
question, is there any normal tissue seen?
Yes, ma'am. This is a normal mucosa, ma'am. Gastric mucosa.
It's normal gastric mucosa, okay. Do you
The
see the
underlying glands.
muscularis mucosae here?
No, ma'am.
You don't. Anybody sees the muscularis mucosae?
Yes, ma'am. Yes, ma'am. I can see, ma'am.
Can you annotate, please?
Yes, ma'am.
That's all right. Yes. So you see here the muscularis mucosae. So you have got here the gastric mucosa. Yes. So let's see that now. You have the gastric mucosa here. And then you have the muscularis mucosae. And this part of it is all looking very normal. All of it is. This is crushed at the bottom over here. This is all crushed, so we can't see anything. But otherwise, this is absolutely normal. And there is something else that we can see perhaps over here, which we will have to see what that is. But because that is deep to the muscularis mucosae. Suveta, can you see this?
Yes, ma'am.
Well, I hope you can see that. I'm not so sure that you could see it. Now come to the right, and what do you see in 2B?
In 2B, it looks like the biopsy is taken from the antral part.
The antral part, all right.
I can see the foveolar epithelium and the glands.
Okay, can you show me the glands, please? Yes.
Yeah, ma'am, this part.
That part.
Yes, ma'am.
You mean that everything from here to here is the glands? Hmm?
Yes, ma'am.
Right. So now, can you tell me if everything is normal here? Do you see any
No,
normal
ma'am.
mucosa?
All glands don't look alike, ma'am.
They don't look alike, okay. Can you see the muscularis mucosae?
No, ma'am.
No, you can't. So really, you cannot assess whether the glands reach right down to the muscularis mucosae, because that's what the muscularis mucosae tells you the thickness of this gastric mucosa, okay? But what you can see, the muscularis mucosae should be somewhere around here. Sorry, I'm so sorry. The muscularis mucosae should be somewhere around here, okay? And you see these very long pits. That means the foveolar epithelium goes all the way down. Not only that, it is branched. You can see branching, which tells you that this is antral mucosa. Okay, and then you have these where you don't see any oxyntic type epithelium. There are oxyntic means that it should have parietal cells and chief cells. At least parietal cells should be there. And these are mucus secreting glands. Okay, and you have the glands are as long as the gastric foveolar epithelium, which reaches down into the pits. What else do you see?
I can see inflammatory infiltrates, ma'am.
Inflammatory infiltrates, very good. Anything else?
Some extravasated mucin substance.
Extravasated mucin. I don't see any extravasated mucin. I don't think there is any extravasated mucin. If you can see it, please mark it. Where is this extravasated mucin?
All this, ma'am.
That's not extravasated mucin. Okay, that's just some sort of serious exudate that, or even something that's crushed by the biopsy. That's not extravasated mucin. Okay?
Okay, ma'am.
So nothing else you can see. Anybody who wants to help her? Dia? No? What about you, Vimi?
I think lymph is also joined in, ma'am.
In the lamina propria.
Excuse me. Can anybody see this? Shweta? What is
Yes,
that?
ma'am. Intestinal metaplasia, ma'am.
Arey wow. Now, what do you mean by intestinal metaplasia? What are you seeing, Shweta?
Goblet cells in the gland.
Which is so obvious. The rest of this foveolar epithelium is plain, simple, mucin secreting, non-goblet cell epithelium. And this one foveolar, a portion of the foveolar epithelium is sticking out over there, all right in the center, and it has got goblet cells. Okay. So now you see the high power of the epithelium on the left, which looks like what? What kind of epithelium is that?
It's a simple mucin containing
On
columnar
the left
epithelium.
side, what is this?
Yes.
This epithelium,
Foveolar.
foveolar, simple gastric type mucin secreting epithelium. And what are the glands?
Is parietal cells.
So this is oxyntic
Oxyntic glands.
epithelium of the gastric body and fundus. All right. And what is going on over here on the right-hand side?
There is intestinal metaplasia with goblet cells.
Right? Anything else?
And
Anything else? Sweta? Jimmy? Anything else? Dia?
Ma'am, I can see one nest. Ma'am, I can annotate that.
Yes, please annotate. Yes, you can see nest. You can see a nest. Is there just one nest?
There are many nests beside it, and ma'am, they are having. Yes, ma'am.
Yes. What are they having?
Ma'am, they are having some
What?
of those cells are
Mhm.
triangular.
There are many nests.
And yes, ma'am. Ma'am, some of these cells are triangular and they have scant cytoplasm. So I thought this may be nest of neuroendocrine cells.
Very good. Sweta, did you see the nests?
Yes, ma'am.
Oh, you did. So why did you not say that there were nests, Sweta? So Dia sees nests. Vimi, did you see the nests?
Yes, ma'am.
Yes, you
Yes, ma'am.
did. Not only that, you can see these nests that are prominently seen at the surrounding some of these mucin type, mucinous glands of the gastric antrum. All right. So there, you have nests over there, and they have these very dense looking nuclei. Okay. The cytoplasm is not very conspicuous, and so you can't say anything. On the other hand, and this is sitting right in the lamina propria, along with lots of, do you see the eosinophils?
Yes, ma'am.
There are plenty of eosinophils over here, and on the left hand side here you can see absolutely normal fundic body type gastric mucosa. There's nothing wrong with the body mucosa or the mucosa on the left hand side. Okay. Now,
Yes, ma'am.
Sweta, what are you seeing here?
Can on the left side, I can see the muscularis propria, and there are
Muscularis propria.
sorry, muscularis mucosae, ma'am.
Yes.
And there are few glands beyond the muscularis mucosae which appears
Glands. Can you please mark the few glands beyond the muscularis mucosae?
they're not glands, ma'am. They're cells beyond the muscularis mucosae.
Sweta,
There is no
I think
glandular
you
arrangement.
just have to make a good description, okay? Not glands. You say where are the glands, and then you say not glands. So make up your mind, Sweta. What are you describing? You can annotate. Can you not?
They are just cells, ma'am.
Do you see any glands at all?
No, ma'am.
You don't. Okay. Vimi, do you see any glands on the left-hand side? Are you there, Vimi?
There is no glands, ma'am.
There are no glands.
Below the muscularis because it shows some sheets and nest of cells.
All right. Dia, do you see glands in this?
Ma'am, in case number 2A, in the right hand side, I can see glands which are normal glands. Ma'am, this portion.
Absolutely right. Absolutely right. You are seeing this is the portion of the deepest portion of that gastric body mucosa. Then you have the lamina propria, which is going to separate the gastric body mucosa from what? They are from what?
Muscularis mucosa separates body mucosa from the lamina propria.
Oh, 1 minute.
Yes.
Muscularis mucosae separates what from what?
Muscularis mucosa separates lamina from the glands from the
Glands.
underlying submucosa.
Yes, so there is the gastric mucosa, which consists of foveolae, gastric glands,
Yes,
lamina propria, as well as the muscularis mucosae, and deep to that, and you are seeing it over here, deep to that muscularis mucosae, you are seeing this piece of there is something that is proliferating over there. Okay.
Yes, ma'am.
Very good. And on this side, within the lamina propria, in case 2B, you are seeing nests, and these are just the high part of the nests that we were seeing. This is within the lamina propria, that is within the submucosa. Do you get it, Sumitra? Suvita?
Ma'am. Yes, ma'am.
Same with you, Vimi. Do you know that on the right hand side here you are seeing in case right here you are actually seeing the gastric mucosa? Yes, here. Oh, sorry, we went beyond that. Oh God, this is what you were seeing in the submucosa, and this is what you are seeing in the mucosa. And what's the difference, Sumeta? Suveta?
On the left hand side, can see these cells are mildly pleomorphic with a round to oval nucleus. They show a prominent nucleoli with the eosinophilic cytoplasm, ma'am. And
You
on
want to show me where these prominent nucleoli are, please? Show me the prominent nucleoli.
Yes, ma'am.
Mm.
Yeah, ma'am. This one, ma'am.
Where is the prominent nucleolus? Where are you marking? I can't see a prominent nucleolus. And where is your mark? Towards the left?
In this nuclei, ma'am.
Oh, okay. So is that the only one you saw, or you
No,
see
ma'am, many
lots and
nucleoli are
lots?
there.
Sorry,
Yes, ma'am, many are there, ma'am.
many nucleoli.
Yes, ma'am.
All right, let me ask the other two. Vimi, you see many nucleoli?
No, ma'am. It's actually a stippled kind of chromatin. No prominent nucleoli being
I
seen.
don't think it is stippled. I think that it has got a very clean nuclear membrane. There are a few small nucleoli that are seen, right?
Small to inconspicuous.
Yes, but they are certainly not prominent. And these are vesicular nuclei. You can see the nuclear membrane very clearly. And in the center, you see a sort of pale nucleus, and all the nuclei are not of the same size. Yeah, I won't say that there is a lot of pleomorphism. Pleomorphism, it does not really come as to me as a diagnostic term that I would use, but there is anisonucleosis. There is also shapes are different. Some of them are round, some of them are irregular, some of them are oval. And I would not say that there were prominent nucleoli, because the nucleoli just don't jump out of you at you. Okay, what are these cells? Are they in the pattern of these cells, Sumeta?
They are arranged in sheets, ma'am.
Very good. They're arranged in sheets. Excellent. Now, if you come to the right, can you actually see the cytoplasmic borders on the left-hand side?
No, ma'am, it's not very distinct.
They are not distinct. Okay, very good. On the right-hand side?
On the right hand side, I can see round to oval cells with the
Round to oval cells.
cells with round to oval nuclei. And these cells have a salt and pepper type chromatin, and they have a prominent granular eosinophilic cytoplasm. They have distinct cell borders are there, ma'am.
Salt and pepper type chromatin. I really cannot see the salt and pepper type chromatin. I know that these have got more or less uniform looking cells. Yeah, they're all round. The cytoplasm is extremely granular, is very pink. Yes. And at the same time, what do you see? You do not see any nucleoli at all. And yes, the cells are denser than what you see on the right hand side. But if you're telling me that you can see a salt and pepper, you're imagining it. And this is typical, no? You know what the diagnosis is, and then you think you can see the features, but you can't see these features, okay? And you also see the goblet cells that are present in this whatever alveolar epithelium that you can see towards the right of this lesion. All right. So now, what is the diagnosis? Is there any, come on now, Sumeta, you have to do case 2A. Is there any normal tissue?
2A, yes, ma'am, you can see the normal mucosa and the glands.
And on the
gastric body
right,
mucosa.
there's
And
gastric
on the right,
antral
there is antral mucosa.
Mm.
And abnormalities in the, yes, ma'am, and
The
the
epithelium is essentially normal on the left side. There is
yes, ma'am.
intestinal metaplasia on the right
on
side,
the right side.
right?
Yes,
The
ma'am.
abnormality is in the submucosa
Submucosa,
side. Here, the abnormality is in the
lamina propria.
lamina propria. Here you have sheets of epithelioid-like cells. Here you have nests of epithelioid cells. Yes?
Yes, ma'am.
And if you had to describe the cells, they have a moderate amount of light eosinophilic cytoplasm, oval or irregular, bland, pale, vesicular nuclei. You thought you could see prominent nuclei. I did not see them. There were no mitoses. Here, we said that, no? Small, medium,
Yes,
etc. Mitoses are not seen. And what else did you see? There was an inflammatory response that was present in the lamina propria, and there is no inflammatory response. You know, this was something that I saw in my dentist's waiting room. It said a gum chewing kid and a cud chewing cow. They are the same yet different somehow. Ah, yes, I get it now. And what's the difference? It's the intelligent look on the face of the cow. So here we have two lesions, both of them looking more or less similar. So now we have to find the differences. And I have written down the differences for you. In 2A, there is a mass lesion. It sheets. In 2B, there was a nodularity in the stomach. Okay? You have sheets, you have nests. These are intermediate sized cells, these are small cells. There is anisocytosis here, this is monomorphic. Pale vesicular nuclei, and here the nuclei are dense. There is normal body mucosa, and here you have intestinal metaplasia and inflammation. So if you have to make some kind of differential diagnosis, what are your thoughts? Come on, so everybody knows that 2B is neuroendocrine hyperplasia stroke neoplasia. What is it in 2A?
Neuroendocrine tumor.
So, who said neuroendocrine tumor? Sueta?
Limpy.
Who, sorry?
Ma'am, Limpy, ma'am.
Limpy, you've joined us. How nice.
Yes,
So,
ma'am.
Limpy, you think it's neuroendocrine tumor. All right,
Yes, ma'am.
very good. Vimy? Are you there, Vimy?
I think it's case 2B. I think it's a neuroendocrine hyperplasia since the
We
nest
know
of cells
about
are
case
same
2B. I don't think that anybody is going to have any problem. What about 2A?
2A, a neuroendocrine tumor.
Neuroendocrine tumor. Limpy, you also thought it is neuroendocrine tumor.
Yes,
So,
ma'am.
Veta,
Yes, ma'am.
Yes, ma'am.
what?
It is a
Neuroendocrine
soft.
tumor. The
Ma'am, I think 2A is a carcinoma, ma'am.
you think it is a carcinoma. All right. Would you like to explain why a carcinoma is arising in the submucosa?
Ma'am,
Little odd.
ma'am,
No?
yes, ma'am.
It's a little odd. Okay, very good. So now tell me which of these tumors, 1, 2, 3, 4, 5, would begin in the submucosa or would be mainly present in the submucosa?
Lymphoma.
Lymphoma. Who said lymphoma?
Suvaita, ma'am.
Suvaita. You said lymphoma. Okay.
Yes, ma'am.
Limpy?
Ma'am, it's lymphoma, ma'am.
Lymphoma. Right. Vimy?
Ma'am, lymphoma.
Lymphoma. Okay. Yes, Dia?
Ma'am, I still think it may be carcinoma.
You may be. I'm just asking you which tumors would arise in the submucosa out of these 5 things. Anything can occur anywhere, but which would be a common occurrence? Everybody said lymphoma. Yes, it is very possible that it arises in the submucosa.
Yes, ma'am.
What else? Nothing?
Neuroendocrine tumor can also.
Neuroendocrine tumor, very good, can occur in the submucosa. Anything else? Unlikely that carcinoma and melanoma will occur in the submucosa, right? What about soft tissue tumor? Or there are no soft tissue tumors that occur?
Can occur in the submucosa.
So then please tell me which soft tissue tumor? Which soft tissue tumor? Who said that? Suveta?
Leiomyoma.
Okay, smooth muscle tumor.
Smooth muscle
Anything
tumor.
else?
Hemangiomas.
Hemangioma. Oh, okay. Anybody else? Limpy, which soft tissue tumor will occur in the stomach?
Ma'am, cyst, ma'am. Leoma.
Gist. Excellent. So, can be smooth muscle tumor or it can be gist. Can either of them have an epithelioid appearance? Can you get an epithelioid smooth muscle tumor or an epithelioid gist? Anybody
ma'am.
answer the question? Yes?
Yes, ma'am. Yes, ma'am.
Oh, excellent. So we have to consider neuroendocrine tumor, gist, smooth muscle tumor, and lymphoma. It's very, very unlikely that you will get a carcinoma and melanoma, leaving the mucosa absolutely intact, unless it is creeping from somewhere else and coming into the biopsy, into the part of the stomach that has been biopsied. Okay? So those are our thoughts. So now let's take case 2A. Here is the CK. All right. So what is it? Come on, Suveta.
It is taken up in the epithelium. It is positive. Ma'am. The
Very
gastric
good.
epithelium. And the glands.
Excellent. So what about the tumor?
Tumor is negative, ma'am.
Right. Now tell me about smooth muscle actin.
It is positive in the tumor cells.
Smooth muscle actin is positive in the tumor cells. Would you like to show me where it is positive? Just ask for annotation. Ask for annotation.
Yes, ma'am.
Yes. Where is it positive?
Yeah, ma'am.
Okay. That's where you think. What about this? Is that also positive?
Yes, ma'am.
Yes.
But it looks like a vessel.
That looks like a vessel. And so what you marked, what was that? It was a tumor cell? What do you think, Suvaita?
Yes, ma'am.
Tumor cell. Where is the nucleus of that tumor cell? Can you show me? Mark the nucleus of that tumor cell.
Ma'am.
Right in the center. You don't think that it is
It
that
is,
this is a vessel in which you've got something that's there? You've got a ring, you know?
Yes, ma'am.
So, so what do you want to say? Is that positive or negative?
Negative.
Ah, okay. So once again, it's not about doing the stain, it's about interpreting it. Very good. Now, what about S100 protein? Is it positive or negative?
It's negative, ma'am.
Negative. What about desmin?
It is also negative.
Also negative. What is this?
CD34
So is it positive or negative?
is positive.
And what's it on the right hand side?
It's not
What's that?
visible.
Sorry?
It's not visible, ma'am. Name.
The name is not visible. Oh, okay. What is it? Is it visible now?
Yes, ma'am. It is
What is
also
it?
positive. CKIT is positive, ma'am.
What is it? What is that? CKIT. What is CKIT? It's called C-kit. It is also known as CD117. What is that? What is that?
No, ma'am.
You don't know, Suveta. Will somebody like to tell her, Limpy, what is that? What is C-kit? CD117?
Marker for gist.
Or gist.
It's a marker for gastrointestinal stromal tumor. So, Sweta,
Yes, ma'am.
what is the diagnosis in this case 2A?
Yes, ma'am. Gastrointestinal
Gastrointestinal stromal
tumor.
tumor. Okay, very good. So it is an epithelioid variant of gastrointestinal stromal tumor. Dia, are you happy about the diagnosis?
Yes, ma'am.
Very good. Okay. And case 2B, there's no prizes for guessing this, but is this, I want to ask Sweta, has this been stained for cytokeratin? It's the same stain on both
Yes,
sides.
ma'am.
Has it been stained for cytokeratin? And I'm
Yes,
asking
ma'am.
this for people in the chat box as well. Has this been stained for cytokeratin?
Yes,
You are
ma'am.
saying yes. What about Limpy?
No, ma'am.
No. All right. Vimy?
No, ma'am.
No, ma'am. Dia?
Ma'am, I think yes.
Yes. Okay. So now Vimy and Limpy, and Limpy, you were not here for a long time. So will you please tell Dia as well as Sumitra? I'm sorry, I got your name wrong. Suveta, why did you think that this is not stained for cytokeratin?
This is
Come on, Limpy. You said it's not
focal
stained for
positive.
cytokeratin, right?
Yes, ma'am.
Are you there, Limpy?
Yes, ma'am.
Very good. So now tell them why you think that this is not stained for cytokeratin.
It's neuroendocrine tumor, ma'am.
So neuroendocrine tumors don't stain for cytokeratin.
No, ma'am.
Oh, really? No, that's
Oh,
not
no.
the reason. Vimy, why is this not a cytokeratin immunostain?
Ma'am, this epithelium is not taken up the normal epithelium is not taken up the stain.
Absolutely right. This is not a cytokeratin stain because you have so much of the epithelium. Do you see the epithelium at all, folks? This is all epithelium. Do you agree, Suveta, that this is epithelium?
Yes, ma'am.
Yes. What does cytokeratin stain?
Epithelial cells.
Epithelial cells. And is this positive or negative?
It's negative, ma'am.
Negative. So this is not a cytokeratin stain. So, Limpy, you were right for the wrong reasons. Okay? You felt that the tumor, and it's obvious that there is tumor over here, that this tumor has been stained, and this tumor is a neuroendocrine tumor, and neuroendocrine tumors do not stain for cytokeratin. My dear Limpy, they do stain for cytokeratin. Has anybody answered in the chat box, Bonita? What did most people say?
There is a mixed answer, ma'am. Some have said yes and some have
And
said
some
no.
had said no. Now I hope everybody knows that this. So what stain is this then? Dia, now what stain is it?
Ma'am, synaptophysin or chromogranin.
Chromogranin. Excellent. It could be one or the other. This is a chromogranin stain, and it's showing you two things. It is showing you that those nests that are seen over there, small and large, are positive for chromogranin, and also that there is neuroendocrine hyperplasia. You can see so many of the foveolar and glandular epithelium showing you more neuroendocrine cells than you expect, and small areas of these nests are also being stained by chromogranin. Has everybody got that now? This is not a cytokeratin stain. Okay, we've got other areas from this. I didn't show all of those in the H&E because there were fragments. This is also chromogranin, and this is cytokeratin, and you have seen that there are small nodules and there is a tumor that you can see. All right. Again, you see in different areas lots and lots of small little nodules, and you have neuroendocrine hyperplasia in the glands. So this is a case of atrophic gastritis. There was partial gastric atrophy with incomplete intestinal metaplasia, neuroendocrine cell hyperplasia, microcarcinoidosis, because there are these small little areas, and a type 1 gastric carcinoid. I'm not going to tell you about type 1 gastric carcinoid and all of this. This is a slide seminar. So all of you please go and read about type 1, type 2, and type 3 gastric carcinoids. Okay? So fine. Now we've come to the second last case, which is case number 3. And who's going to take this now? Did Vimy? Yes, Vimy, you can do this.
Ma'am, case number 3A, 30-year-old female, excision of a painful 3 centimeter mass in the supraclavicular fossa.
Okay.
And case 3B is 88-year-old male with recurrent cutaneous, subcutaneous swelling over the left knee. A bleeding lesion was excised from the same site 8 months before the present time.
All right. Now, Vimy, you just have to tell me what is the similarities between these two. Okay. What are the similarities that you're seeing between the two?
Both are showing dilated spaces with hemorrhage.
Okay. So there are dilated spaces in which there is blood. Yes.
Yes.
All right. Any other similarities that you see?
There is no
much, huh?
normal tissue in both.
All right. Now you can see the similarities, right? Which you said that there are some dilated spaces filled with blood. Is that really observationally correct?
Yes, ma'am. It's filled with blood, so I'm thinking it's a vessel, blood vessel.
Okay, so
Multiple
you think that these are blood vessels because they are filled with blood. Do you notice something on the right hand side that is case 3B? Yeah, there are other spaces, right?
Yes,
Oh,
there are
yes,
multiple.
there are other spaces. There are spaces, some with some blood in it and others not. And you also see some spaces that are very almost like cracking artifacts in the tissues. You see that here? You also see
Yes,
it here on this side. Okay, but this space on the in 3B is a very well defined space. You can see all these spaces are extremely well defined. When you see a space here on the left hand side, except for one space which looks relatively well defined, yeah, these are just like areas of hemorrhage. They are not spaces that are filled with blood. You see the difference between the two?
yes, ma'am. Yes.
This is observationally very, very important. This looks like just on the left-hand side, pure hemorrhagic areas in the tumor. There are spaces. You can see that there is a space even on the left-hand side, but they are not filled with blood. Okay. Now, what else do you see? More or less the same thing. Yes. And you're beginning to see now what is on the left-hand side, please, Vimy. What is this?
Ma'am, on case 3A, I'm seeing blood vessels which are surrounded by spindle cells.
Spindle cells, yes. Anything about the blood vessels that you need to note?
The vessels appear some hyalinized. The wall
Yes, there
appears
are many
hyalinized.
blood vessels, and you can see them at the bottom of this, and they are all showing you a hyalinized wall. On the other hand, on the right-hand side, yes, you see spaces, there is blood, but you do not see hyalinized blood vessels. Is that right?
Yes, ma'am.
Very good. Now look, once again comes up the space on the right side, and there is blood that is present in the space. On the left-hand side, what do you see?
There is
It's spindle, yes.
spindled
And it is
to
arranged in
avoid cells Some are having pale eosinophilic cytoplasm and some appears clear cytoplasm.
Excellent. Very good. Yes, Vimi. And the arrangement of the spindle cells is in?
There is a fascicle.
Yes. So the spindle cells are in fascicles. And once again, a fascicle is a bundle.
Disordered fascicles,
Yes.
irregularly arranged fascicles.
Yes. But what is a fascicle? Can you define a fascicle, please? Vimi? Fascicle is a bundle made up of elongated cells in which all the cells are running parallel to each other and parallel to the direction in which the fascicle is running. Okay, so you have got fascicles. Maybe there's a little bit of a herringbone pattern over there. Okay, but you were absolutely right. There are areas which have got clear cells and others that are frankly spindle. On the right hand side, you see something else. And what is that? There is a condensation of cellularity
Around
around
that lumen, ma'am.
a
Around that
condensation of
spaces,
cellularity around the
spaces that
spaces.
spaces filled with blood.
Very good. Yes. And now you can see both at reasonably similar power. And what do you see?
The similar observation and in case 3A, there are a lot of smaller vessels with hyalinization
Yes,
and
excellent.
splinting cells and clear cells, which is arranged in slightly haphazard vesicles, like short interlacing.
Here it is, looks like sheets, no? Except that it
Yes,
may
ma'am.
be that the fascicle is actually cut at right angles, and that's why the cells don't seem to have very spindly nuclei. So that happens when you have a broad fascicle that is cut at obliquely or at right angles. And on the right hand side, there are more sheets. There are not too many fascicles. But what do you want to say about the space? You said that you thought they were blood vessels, these spaces. Do you think that these are vessels, Vimi?
It doesn't have a proper endothelial lining. It's showing.
So these are non-endothelial lined spaces, but they are sharp spaces. It's not just some crack over there. These are actual spaces. I mean, you recognize them as being spaces. Okay, you see it again here on the right-hand side. And on the left-hand side, you see hyalinization. You see these vessels that are almost showing you what you see in glioblastoma. That's endothelial conglomerates. Yes,
Glomeruloid microvascular proliferation.
exactly. Microvascular proliferation is being seen. And you see these cells here looking, the nuclei looking round. Why? Because it's a fascicle that has been cut at right angles. And
Yes, ma'am.
on the right hand side, what do we see? We see the clinging of these of the cellular areas. They cling around these very definite spaces, but the spaces are not lined either by epithelium or by endothelium. Okay, you can see that. And now you can see the hypars of both. The hyalinization of the blood vessels on the left side. And what are you seeing on the right side now?
The cells appears forming a nest, vague nest.
They're not in nests, they're more in sheets. No, but they are nodules. You see the nodules because you were able to see that. They are nodules at the center of which you are seeing these spaces. So there were nodules, and there is this degree of pleomorphism. It's not marked, but it's there. You do see the variation in nuclear shape, size. Quite a number of them are spindle cells, but some of them are not spindle because their nuclei have taken many different shapes. Some are round, those may be fascicles that are cut, but the others are not like that. See again this nodularity that you are seeing? Here
Yes,
there is
ma'am.
monotony. On the other side, that is not monotonous. And then you look at it at high power. And now you can see these nuclei on both sides very, very close And these are spindle, or when the fascicle is cut at right angles, they are round. But what are these? Apart from being spindle, some of them are.
Market pleomorphism for the
It's not
nucleus.
these nuclei. Some of them are triangular, almost, or irregular, which suggests that their cytoplasm cannot be spindle, right?
Yes, ma'am.
Cytoplasm is probably stellate. It's not all over. There are some stellate cells. Many of them are spindle, but there is some degree of stellateness to the shape of these cells.
Yes, ma'am.
So, yeah, so this is at high power. So now let us, somebody wants annotation. I don't know who this is, but I'm not going to approve it because it's somebody else. Okay. Now the periphery of case 3b. What do you see at the periphery of case 3b?
Ma'am, in case 3B, there is inflammatory cells
Ah,
predominantly
periphery.
composed of lymphocytes, eosinophils, plasma cells,
Yes.
and some
You see this?
hemosiderin
This
laden
is a
macrophages.
nodule, no? A lymphoid nodule. There is a
Yes,
mixture of
ma'am.
lymphocytes, plasma cells, eosinophils, but there is a clear lymphoid nodule. At the
Yes, ma'am.
this nodular lesion at the periphery has got a lymphoid nodule. This is the low power, this is a higher power view of the same. So now, what do you think? Come on, Vimi. Case
Ma'am,
3A.
3A is a vascular lesion, which is having this
Okay. Any other
ovoid
thoughts?
spindle
A
cells,
spindle
glomus
cell
tumor,
vascular lesion, right? That's what you think?
like a perivascular lesion.
No, sorry. Are you saying that this is a lesion with vascularity or is it a vascular lesion? Is it arising from vessels
This is a
or is it a
vascular
vascular?
lesion, ma'am.
No, so what do you mean? A lesion with, it is actually arising from an endothelial cell. Is that what you're saying?
No, ma'am, it's not from the endothelial cell.
Then, so when you say it's a vascular lesion, what do you mean? Every lesion is vascular, no?
It is arising from the periendothelial cell.
So you think it's a hemangiopericytoma or it's a myopericytoma or it is a what?
Glomus tumor, ma'am, glomangioma.
Glomus tumor. Acha. Okay. Very good. Anybody else? Limpy? Limpy. Limpy is lost. Are you there,
Ma'am,
Limpy?
I thought it was. Yes, ma'am.
So tell me, what did you think about
Yes, ma'am.
case 3A?
Ma'am, I thought it was neuro.
I can't hear you, Limpy. It's a what?
I thought it was Swanoma, ma'am. Swanoma.
I can't hear. What did you say?
Ma'am, I thought it was Swanoma.
It looks like a schwannoma. All right. So you think it's a
Yes,
schwannoma.
ma'am.
Very good. What about you, Dia?
I thought it's a vascular transformation of the lymph node, probably a nodal angiomatosis.
Nodal angiomatosis. All right. And we have now Suvaita. Suvaita? Suvaita? She's gone. Have we lost Suvaita?
I think she's not there, ma'am.
Yeah, okay, we've lost Suvaita. All right. So let us start from the beginning. All right. Is this congenital or acquired? Come on, Vimi. Vimi, are you there?
Acquired, ma'am, acquired.
Correct. Next.
Pathological,
Yes.
neoplastic,
All right. You think it's neoplastic. All right then.
and it's
Benign or malignant?
benign tumor, ma'am.
Benign. All right. It's cellular. So is it benign or malignant? So now we have to go and find out what it is, right? We have to make a description. So it is a circumscribed. It was you know the history. It was a painful mass in the neck, and you described it right. There's fascicles of spindle cells in a cellular and loose arrangement. You saw the clear cells over there, and there were foci of hemorrhage. Also, what has not written over here, that there are these distinct blood vessels which have a hyalinized collar. So now tell me what we are describing. What are we describing? Huh? Come on. Circumscribed pain. Yes, please. What?
We are describing a schwannoma, a benign neural tumor.
So I describe it and you make a diagnosis of a schwannoma. And that is exactly what I keep telling you on and on and on. A description should be such that somebody who is blind can actually make that diagnosis. You saw what I saw. Isn't that right? You saw what all of us saw, but you came to the diagnosis of what? A vascular tumor. Yes, pericytoma. But when I described it, and is my description made up, Vimi? You had the same description. Yes or no? What, Vimi? Have I made up this description or did you describe it the same way? Vimi, you also
I
disappeared.
actually didn't describe it as a cellular and loosely areas, ma'am.
Yes, so? No, I'm sorry, Vimi, but how did you reach the diagnosis of a schwannoma? The same way that when I described it, right? So have I described this wrong?
No, ma'am.
No, ma'am. You saw what I saw, and yet your observations and your description were different from what I described it. So I must say, Limpy, you made the diagnosis of schwannoma. That is excellent. So this is, yes, a schwannoma. It is it is not a lymph node. There was no lymphoid tissue over here. It was circumscribed, yes. But many things are circumscribed and they're not lymph nodes. Okay. So what actually is the diagnosis? It is a schwannoma with degenerative changes. Okay, now this is not something that you should not be able to recognize, provided you make the right observations, the right interpretation, and then you can make the right diagnosis. Agreed with me? Do you agree, or do you have some questions? Ask me now. Do you have any questions, Vimi? Vimi, have you disappeared or are you there?
No, ma'am. It's right. Yeah.
So you have any
Yes, ma'am.
questions?
I'm not able to unmute myself. That's right. Yes, ma'am. It's schwannoma with degenerative. I made a mistake. Yes, I agree with the diagnosis.
Okay. And the only reason that you didn't make the diagnosis is because you didn't make you made the right observations, but your interpretations were not consonant with your observations. All right. So now we come to 3B. Come on, Vimi. You see this? These are
Yes, ma'am.
yeah. Now come on. Just like we described there, just put it into one sentence. What? Not one. Yes, one sentence. What you are seeing, and then you will reach the diagnosis. Come on. This is an 8-year-old, so it's a child with a recurrent lesion in the arm, which is nodular, which has cells with a minimum amount of pleomorphism. It is largely spindle, focally stellate, has got very distinctive spaces within the lesion in which there is hemorrhage, and these spaces are not lined by endothelial cells. At the periphery, you are seeing lymphoid tissue. Now, come on. I've said the whole thing. So what is it, Vimi? Nodular soft tissue lesion, which is recurrent, which is minimal pleomorphism, surrounded by somebody must be saying something in the chat box. What is in the chat box? What's the diagnosis?
No response so far, ma'am.
Nobody so far. I think they've all gone to sleep. Deepa, what's the diagnosis? No? Limpy? Limpy?
Ma'am, are you asking me?
Yes, anybody. Come on.
Ma'am,
Ma'am,
there are
I thought it is a case of epithelioid hemangioma.
Epithelioid hemangioma.
Yes, ma'am.
Yes. A hemangioma, who's that, Dia? Is it
Yes,
Dia?
ma'am.
Who said epithelioid hemangioma?
Ma'am, I said.
Who's the I?
Ma'am, Dia.
Dia. Dia, and hemangioma is a tumor of what
Blood
cells?
vessel.
Don't say
Of
blood vessels.
endothelial cell.
Endothelial cells. So you see spaces lined by endothelial cells?
Ma'am, I thought the blood vessels were lined by endothelial cells.
Blood vessels. Which blood vessels? You don't think that these spaces are part of this tumor, or they're just there for just by the way? What? Because it is such a characteristic part of this tumor, right? And they're
Yes,
not
ma'am.
lined by endothelial cells. So it's a bit odd, no, for it to be blood vessel tumor. But anyway, you said blood vessel tumor.
Yes, ma'am.
Right, very good. What about Vimi? What did you say, Vimi? Vimi is unable to unmute herself.
Ma'am, I thought it was a caposiform hemangioendothelioma.
You also thought it was hemangioendothelioma. Limpy?
Ma'am, epithelioid hemangioma, ma'am.
Epithelioid hemangioma. Okay. Who else is there? Suvaita.
Yes, ma'am.
What?
I thought it was epithelioid hemangioma, ma'am.
See, for anything that has to be of vascular endothelial origin, you should be seeing endothelial cells that are lining something. And if you're all saying that it is benign, then there should be vascular spaces lined by endothelial cells, and they are not there. And you said that they were non-endothelial lined spaces. Okay? So, all right, it is acquired, it is pathological, it is neoplastic. Question is it benign or malignant? So let us find out what this shows. It shows plump cells with vesicular nuclei, some nuclear irregularity, and no mitotic figure. So all of you think that it must be benign because everybody has said that it is hemangioma. There are spaces containing blood but not lined by endothelial cells. And there's lymphoid follicles at the periphery, and this is a nodular lesion. It is recurrent in an 8-year-old child, and there is only one tumor. If you had put all this into your Google, you would have known exactly what it is. And this is an angiomatoid fibrous histiocytoma. Now, I do not think that if you didn't make the diagnosis, you are wrong. But if you had made all these observations and put it together, one thing I can assure you, you should not have reached the diagnosis of an epithelioid hemangioma or hemangioendothelioma, because there are no endothelial lined spaces, number one. And for epithelioid hemangioendothelioma, you may not have epithelioid lined spaces, but you should have blister cells, cells with blisters, some of them actually containing a red blood cell. Okay, so never mind, you didn't make the diagnosis, but this is an angiomatoid fibrous histiocytoma. Now you all have this. You already have these pictures. So go look at them, read the books, and it will tell you what this entity is and how it looks. Okay. So here, nothing helps. No immunohistochemistry helps. So you can do everything. You can do. Here you are, 31, 34. If you thought that this was an endothelial cell tumor, it is not. It's not marking with SMA, desmin, S100 protein. If you want to do something and you don't need it, it is so typical. You can do an ATF Krebs assay, which we did, and it was possible. But this is not because we needed to do it. It was just done as a matter of course. Okay, so this is a epithelioid. I'm sorry, this is not an epithelioid hemangioma, hemangioendothelioma. This is an angiomatoid, and it is called angiomatoid because it resembles some kind of angioma-like thing, but it is not of vascular endothelial origin. Okay, and we can go and read about what it is. Now, last, who's going to take this? Limpy, you have arrived on the scene. Come on, Limpy. What's the diagnosis in this 48-year-old male? Are you there, Limpy? Limpy? Has she disappeared?
Limpy, please unmute yourself.
Are you there, Limpy?
Yes, Limpy is there, ma'am.
But I don't know.
Bad connection. All right, we'll go back to Dia. Come on, Dia.
Yes, ma'am.
Okay.
A 48-year-old male with a specimen of distal partial gastrectomy, gross examination showed a polypoid mass measuring 2.5 centimeter in size on the lesser curvature.